I am speaking on behalf of Professor Dr. Zahid Mahmood, Professor of Surgery at Lahore Medical and Dental College, Lahore. In this series, we will cover important SEQs from UHS past exams. These are high yield for your professional exams and essential for clinical practice. SEQ 1, a 25-year-old poultry farm worker cannot open his mouth for 3 days. He had a foot injury 10 days ago that was not treated. Answer: the diagnosis is tetanus. Management includes isolation in a quiet room, proper wound toilet and drainage, human anti-tetanus globulin 25 to 500 units intramuscular, tetanus toxoid for active immunity. In severe cases, nasogastric feeding and sedation. If breathing is compromised, perform tracheostomy. Prognosis is guarded. Moderate to severe disease carries 30 to 40% mortality. Closing. In exams, always write diagnosis, management, and prognosis in order. SEQ 2, tuberculous lymphadenitis case. SEQ 2, a 15-year-old girl presents with a swelling in her neck, night sweats, hemoptysis, and weight loss. Answer: the likely diagnosis is tuberculous lymphadenitis. Important investigations are sputum for AFB, chest X-ray, FNAC or excision biopsy, ESR and baseline liver function tests. Management includes nutritional support and hygiene, anti-tuberculosis drugs, regular follow-up to monitor side effects. Closing. This is a common exam question. Always link the systemic features with the neck swelling SEQ 3, oral carcinoma. Case SEQ 3. A 40-year-old woman has an ulcer in her oral cavity for 2 months. She is a pan chewer. A small cervical lymph node is also present. Answer: suspicion is carcinoma of the oral cavity. Why? Because there is a chronic ulcer, cervical node, and a risk factor, pan chewing. Investigations include incisional biopsy of the ulcer, FNAC of the lymph node, CT or MRI for local spread, ultrasound abdomen for metastasis. Closing. In your answer, always mention risk factors, suspicion, and then scientific workup. SEQ 4, synergistic gangrene. Case. SEQ 4. 6 days after surgery for perforated appendix, a 50-year-old diabetic lady develops gangrene around her abdominal wound. She looks toxic. Answer: the concern is synergistic gangrene with septicemia. Clues include diabetes, old age, and steroid habitus. Management: broad-spectrum antibiotics, penicillin, metronidazole, gentamicin, aggressive wound debridement, control of blood sugar, monitor vitals and fluids, blood transfusion if required, secondary closure or grafting only after infection clears. Closing. This is a life-threatening condition. In exams, mention both infection control and wound care. SEQ 5, thyroid swelling case. SEQ 5. A 77-year-old woman has a swelling on the right side of her neck. It moves with swallowing. She has mild dysphagia but normal voice. Answer: investigations include thyroid function tests, FNAC, indirect laryngoscopy, and chest X-ray. Operation is advised if FNAC shows malignancy. Possible complications of surgery are hypothyroidism, hypoparathyroidism, recurrent laryngeal nerve injury, hemorrhage, recurrence of disease. Closing. In exams, structure your answer as investigations, indications, and complications.